Good afternoon, Mr. Chair and members. Today I want to share a personal story that has a positive outcome, but many women don't have the same fate. This bill that I'm introducing today, SB 492, the Maternal Outcomes Measure Act, is about and for those mothers and children lost and their tragic outcome that could have been prevented. Last month, I celebrated my birthday, and over the weekend, our family celebrated with my brother his. Our story could have been different, and my mother frequently reminds me of this, and I have taken her story for granted for so many years. My mother is my best friend, and the sadness in the tone of her voice every time she repeats the story should have raised a red flag. You see, my mother came to this nation as an immigrant from Mexico at the age of 19. New to this country, she had no friends, no relatives, and no understanding of the English language. I can't even imagine the pain she endured. There are times when we drive past the old shattered and now abandoned hospital building in Fresno's Kings Canyon Road. The broken windows and faded red bricks of the 6-story building represent not only the story of an abandoned hospital, but the story of the broken healthcare system within some of California's poorest communities becoming victims to it. I was alone in the hospital and I cried every day. Mija, we spent 8 days, 7 nights together in that hospital. They wanted to separate us, but I signed the document to make sure we were together. My mother often shares with me. The document they waived to release the hospital from any liability upon her release. Her signature acknowledged her health state was grave, but she did it anyways. She had endured a prolonged labor. My life and hers were at risk. While my family's story has a happy ending, this is not the case for many women of color who live in the most impoverished communities across our nation, including ours, with the Central Valley having the highest number of maternal deaths in the state. Maternal and infant deaths are happening across the nation at hospitals like the one I was born in, with women and children with very similar stories. And SB 492 requires the California Department of Public Health to track and review data on structural cofactors relative to pregnancy-related deaths. CDPH is charged with tracking maternal deaths associated with certain health conditions. And currently, CDPH does not track potential structural cofactors in pregnancy-related deaths, including whether the individual had died, had commercial or Medi-Cal coverage, what sort of access to care they had during pregnancy, or where they live or work played a role in their death. Some hospitals have taken additional steps to collect data to improve care and save lives, but there are still additional factors to consider when tracking maternal morbidity. While health inequities, especially the lack of healthcare providers or access to hospitals, play a great role in the health outcomes of patients in this region, we must do better at protecting pregnant women. We must be intentional, but we cannot be intentional without the adequate data. Protecting pregnant women means ensuring that they have the highest quality and standards of care. Reports indicate that significant racial and ethnic disparities in pregnancy-related mortality exist, and that Black women specifically have a pregnancy-related mortality ratio approximately 3 times higher than white women. The CDC tracked data from 13 maternal mortality review committees from 2013 to 2017 and found that 3 in 5 pregnancy-related deaths were preventable. The CDC indicated that contributing factors and prevention strategies can be at the community health facility, patient, provider, and system levels. SB 492 requires CDPH to conduct additional tracking around pregnancy-related deaths to include various patient demographics, healthcare access, and insurance coverage status. The bill also requires CDPH review pertinent records, medical or hospital records, death certificates, and medical examiner reports in their efforts to track this data. It is my hope through the MOM Act that California can continue to improve and further prevent deaths of moms.